Welcome to the orientation class for St. Joseph Kidney Transplant Center. We encourage you to watch this video at your own pace and encourage your family members to do the same. Here at St. Joseph, our promise is to know you, care for you, ease your way, and this presentation is how we begin to do just that. In this video, I will give you information about the kidney transplant process, what you can expect, and what you will need to do. I will introduce you to our transplant team, and I will help you form questions to ask your transplant team at your next appointment. Of the 6,000 hospitals in the United States, less than 250 of them are certified by the federal government to perform organ transplants. Kidney transplant is paid for by the U.S. government through Medicare and is highly regulated and overseen by the government. This relationship ensures quality of care and access to transplantation in the United States. St. Joseph Hospital has been certified by Medicare to perform kidney transplants since 1973. You have been diagnosed with end-stage renal disease, ESRD, or are approaching end-stage renal disease. This is also known as chronic kidney disease or chronic kidney failure. You cannot live without kidney function, although you only need 30% of the function you were born with to feel normal and healthy. There are two ways to replace kidney function. One is dialysis, which includes hemodialysis or peritoneal dialysis, and the other is kidney transplant. Your nephrologist, your kidney doctor, will discuss your dialysis treatment with you. In general, dialysis replaces only 12% of your kidney function, and most people don't feel well on dialysis. Transplant has the opportunity to provide up to 50% of kidney function and double your life expectancy compared to staying on dialysis. Everyone in the United States can receive dialysis when they need it, but only a fraction of patients with kidney failure can receive a transplant. This is because most patients on dialysis are too sick to survive a transplant. You have been referred to St. Joseph's Kidney Transplant Center to determine if you can benefit from a kidney transplant. A successful transplant may provide you with a better quality of life because it allows greater freedom and is often associated with increased energy levels and a less restricted diet. However, the potential benefits cannot result from surgery alone and are dependent on your ability to follow the rigorous treatment plan prescribed by your transplant team. The first successful kidney transplant was performed in December 1954 in Boston between two identical twin brothers. Survival rates greatly improved in the early 1980s with the introduction of new anti-rejection medicines. Today, kidney transplant is very successful because of these medications. St. Joseph Kidney Transplant performed their first kidney transplant in 1973. To receive a kidney transplant, you must have a kidney donor. There are two types of kidney donors, living donors and deceased donors. A living donor is a healthy individual who volunteers to donate a kidney to another person. A living donor may be one of your relatives or a person who is not a blood relative to you. If you have a potential living donor, that donor will go through a thorough evaluation process to determine candidacy as a live donor. All potential donors are presented at our transplant selection committee that is comprised of the members of your transplant team. Your transplant team will determine if an individual is accepted or declined as a potential donor. You will be notified only whether your potential donor was accepted or declined. Specific issues concerning why your donor was declined is confidential and will not be discussed with you. We will only accept a living donor if we believe that they will lead a normal life after donation. St. Joseph Kidney Transplant Center will not accept potential donors suspected of having been solicited by a kidney transplant candidate or the candidate's agent through personal or commercial website, by any means of advertising, or possible illegal arrangements. Donors cannot be paid for donation or be employed by the recipient or recipient's family. The live donor transplant is always a scheduled surgery. It is never done as an emergency surgery. In the donor evaluation, the main concern is health, safety, and confidentiality of the donor. We have a separate donor team which leads the donor evaluation. This includes a donor coordinator, donor advocate, donor nephrologist, and surgeon. All donor information is confidential and will not be discussed with the transplant recipient or their family. A deceased donor is an individual who has been legally declared dead and consent has been obtained either by that person or their next of kin to donate organs. Death has occurred from some kind of trauma, such as an auto accident or a head injury, or from a disease process, such as a stroke. When brain death has occurred, the surgery to remove the organs occurs with the donor on a ventilator. If brain death has not occurred, the organs are removed after the donor's heart has stopped beating. There is a severe shortage of kidneys for transplant. The waiting list continues to grow faster than the number of kidneys available. Today, there are over 90,000 patients waiting for a kidney transplant. As you can see here, every year the total number of kidneys available is about 20,000, but an equal number of new patients is added to the wait list each year. Because of this shortage, there is a long waiting time for a deceased donor kidney. The waiting time can be estimated based on your blood type. If you are blood type AB, the average waiting time in this area is 4 to 5 years. If you are blood type A, the average wait time is 7 years. If you are blood type B, the average wait is from 8 to 12 years, and if you are blood type O, the average waiting time is 10 years. If you have a living donor, there is no waiting time. It is our responsibility as a transplant center to provide you and review with you the recent statistical data on St. Joseph Transplant Center from the Scientific Registry of Transplant Recipients. You can find the most current data for St. Joseph and all transplant centers at www.srtr.org and/or www.optn.org. In addition, this information is presented during your initial orientation with your transplant surgeon. The results for St. Joseph Transplant currently meet or exceed national standards. A copy of this data report will be provided to you and is posted at the Transplant Center. The report includes the program's current 1-year post-transplant patient survival rate, 1-year post-transplant graft survival rate, and available outcomes on living donors and how St. Joseph Hospital compares to the national average. Specific outcome requirements need to be met by transplant centers, and we are required to notify you if we do not meet those requirements. Currently, St. Joseph Kidney Transplant Center meets all the requirements for transplant centers. An evaluation process for kidney transplant involves having an exam, many tests, procedures, and visits with many members of the transplant team and other doctors. All these consultations, tests, and procedures will help us determine if a kidney transplant is the right treatment for you. It will also help us to know if you are well enough to have the kidney transplant surgery. Let me introduce you to our transplant team. We currently have 3 transplant surgeons on our team. Dr. Irvin Ruzix has been our medical director and transplant surgeon since 1996, coming from UC Irvine. Dr. Eric Wallstrom joined our team in December of 2018, coming from Riverside Community, where he was medical director and transplant surgeon. Dr. Robert Naragi joined our transplant team in January 2020, coming from St. Vincent, Los Angeles, where he was the medical director and kidney transplant surgeon. One of these transplant surgeons will meet with you and discuss the appropriateness of a transplant based on the information obtained during your evaluation. A complete history and physical will be obtained during your visit with the surgeon. The surgeon will also discuss the significance of undertaking a kidney transplant, the various types of kidneys available, and the risks of the surgery and possible complications after your transplant. The transplant coordinator is a registered nurse with specialized training and certification in transplantation. She provides education and coordination of the transplant evaluation process, establishes your listing for transplant, and reviews patient responsibilities before and after transplant. You will meet many times with your coordinator. You will have the opportunity to ask questions and to become fully informed about the kidney transplant process. One of our transplant coordinators are always available if you have an emergency regarding your kidney transplant. We have several transplant assistants who work under the direction of the transplant coordinators. They are non-licensed personnel with specialized training in transplant. They will assist with the scheduling of tests and appointments and obtaining medical records for the transplant team to review. A nephrologist is a physician who specializes in kidney disease. The nephrologist will assist in the medical management of your kidney disease and work with the transplant team to determine if you are medically suitable for a transplant. While you are waiting for a transplant, your nephrologist will manage your dialysis treatments to keep you healthy for that day. A social worker is especially trained in the issues of transplantation, will meet with you to evaluate your ability to cope with the stress of transplant and your ability to follow a rigorous treatment plan both before and after the transplant. The social worker will also help you identify your support network. Our independent living donor advocate is a licensed marriage and family therapist who meets with every potential live donor to assess their ability to cope with the stress of the surgery and their understanding of the transplant process. She ensures that the rights of the donors are protected, ensures that donors are not coerced into donating, and ensures that the donors' expectations are realistic. All her interviews are strictly confidential. Our financial coordinator will become your new best friend. She will discuss the costs associated with your transplant and the costs of medications you will require after transplant. The financial coordinators will work with you to help you understand your insurance coverage. It is important that you understand the costs that may not be covered by insurance. It will be important to speak with the financial coordinator before making any changes to your insurance plan, as these changes may affect your ability to have a transplant at St. Joseph's Hospital. A registered dietitian will meet with you and perform a nutritional assessment and provide nutrition education to the patient. Patients will be referred to other physicians for consultation as needed. For example, many patients need to be seen by a cardiologist, a heart doctor, to decide if their heart is strong enough for a transplant. You may need to see a pulmonologist, a lung doctor, to decide if your lungs are strong enough for transplant. If you are diabetic, an endocrinologist will be called upon to help manage the changes your diabetes treatment after transplant. Our nurse practitioner is a certified advanced practice nurse who provides assessment and management of medical problems in the evaluation, perioperative, and post-transplant phases. The nurse practitioner works in collaboration with other members of the transplant team. Our physician's assistant is an integral member of our transplant team. She will be involved in your transplant admission process, assist in surgery, and continued care throughout your hospitalization and post-hospital care. Our Director of Renal Services and our Clinical Coordinator are available to assist you if you have any questions or concerns about your care at St. Joseph that cannot be addressed by another team member. Our medical receptionist will greet you in the front office. Behind the scenes, we have information specialists who help us keep your medical records safe and accessible to our healthcare providers. Many different tests are done to determine if you are a suitable transplant recipient. Some of the tests may be included in your evaluation process. Depending on the results of your tests, further testing or consultations may be required. We will do a lot of blood tests and urine tests. Tests performed include determining your blood type, and tests used for organ matching and to prevent kidney rejection, that include tissue typing, which are genetic markers called human leukocyte antigens, or HLA, and a panel of reactive antibodies, PRA. We perform viral and communicable disease testing that includes, but is not limited to, HIV, hepatitis B and hepatitis C, and syphilis. Additional tests are used to determine how well other organs or systems are functioning, including cancer screening. We will do chest x-rays, we will do EKGs. You will be referred to a cardiologist who may order other heart studies such as echocardiograms, cardiac stress tests, or coronary angiogram to determine your heart function. An ultrasound of your abdomen will help us assess the size and shape of your kidneys, check for gallstones or masses in your other organs. Pulmonary function tests may be required, especially if you have a history of smoking or a history of lung disease. This is a breathing test that's used to analyze your lung function and capacity. If you are over 50 years of age, you will need a current colonoscopy. Women will need to have current and updated Pap and mammograms. Patients will need to have dental clearance. If you smoke cigarettes, you will be referred to a smoking cessation class. It will be important to have all immunizations up to date before transplantation. It is important that you quickly complete all of the consultations and tests required. Missing or canceling appointments will delay and prevent you from being accepted as a transplant candidate. If you have any questions during this process, call your transplant coordinator. All patients who go through kidney transplant evaluation process are presented at our transplant selection committee. Your transplant team reviews and discusses your test results and makes recommendations on whether you meet the criteria as a transplant candidate. You will be contacted regarding the transplant team's decision. Our goal is to make sure your health and social support is optimal for a safe and beneficial kidney transplant. On occasion, you may be reviewed at the kidney selection committee to discuss changes in medical or social status, or to reevaluate your candidacy for transplant. You may be placed on hold until your situation can be fully investigated. Again, you will be contacted regarding the transplant committee's decision. The National Organ Transplant Act required the development of an organ procurement and transplantation network that links all professionals involved in the nation's organ donation and transplantation systems. The United Network for Organ Sharing, UNOS, operates the OPTN under contract with the U.S. government. When you are accepted as a transplant candidate, the transplant team will obtain authorization for your kidney transplant from your insurance company. You will be registered on the National Organ Transplant waiting list that is maintained by UNOS. Your name will appear on this list as an active candidate at St. Joseph's Kidney Transplant Center. You will receive notification from the transplant team with the date that you were listed. If you are on dialysis, your waiting time starts the day you started dialysis. If you are not on dialysis at the time of listing, your waiting time starts the day you were listed. We will ask you to provide us with a list of contact numbers so that when a kidney becomes available for you, we will be able to promptly contact you. According to UNOS policy, the transplant center has 1 hour to accept a kidney offer. If we are not able to contact you within that hour, we may lose the opportunity to offer you a kidney. While you are on the waiting list, you must provide us with up-to-date insurance information. Inform us of any new illnesses, transfusions, or hospitalizations. You must complete the required periodic blood tests. You must complete an annual reevaluation. You will have an appointment with the transplant team at least once a year, more frequently if there are changes in your health. Patients who are active status 1 on the waiting list are ready to receive an organ offer at a moment's notice. But what if you have a temporary change in your medical, social, or financial condition that makes a transplant impossible? Instead of taking you off the list until the issue is resolved, we will place you on hold, or status 7. On status 7, you do not lose any waiting time, but you will not receive any kidney offers. Once the issue is successfully resolved, your status is changed back to status 1. Multiple listing. Under OPTN policy, you can be listed at more than one transplant center that are in different areas. This is called multiple listing. Each transplant center has its own evaluation process, and it is up to the individual center to decide to accept you as a candidate or not. You should check with your insurance company to see if they will reimburse the cost of additional evaluations or other costs that might be associated with multiple listing. In addition, you will need to maintain current lab results and contact information as requested for each transplant center where you're listed. Kidney allocation. Who decides who gets what kidney? UNOS developed medical criteria and policies for the recovery of organs and balances fairness and accountability in organ allocation. UNOS matches organs to waiting recipients by the National Computer Registry according to the policies of UNOS. The allocation of kidneys takes into consideration compatible blood type, waiting time, time on dialysis, antibodies, tissue typing, and pediatric status. A computer matches the donor's medical characteristics with the medical information of the transplant candidates and generates a ranked list of patients for that kidney. Kidneys are offered to the transplant candidate in the ranked order in which the recipient's name appears on the computer match. For example, if your name is first on the list, you will receive the first offer. If your name is second on the list, you will receive the second offer. The transplant team reviews the donor and kidney information to determine if this is a suitable kidney for you. If we accept the kidney for you, the transplant coordinator will contact you to ask how you're doing and to give you instructions. It will be very important for the kidney transplant coordinator to be able to contact you at any time. If we are not able to reach you within an hour, we may have to decline the kidney as per UNOS guidelines. On occasion, we may have to decline the kidney after we had initially accepted the kidney. Reasons that a kidney may be declined are that another blood test shows that the kidney is not compatible with you, or the final data on the kidney or donor deems it unsuitable, or on visual inspection, the kidney is not suitable. Although this is a great disappointment to you and the transplant team, our goal is to transplant kidneys that will give you the most benefit. Organ risk factors that could affect the success of the transplant or health of the recipient include, but are not limited to, the donor's history, the condition or age of the organ used, and/or the recipient's risk of contracting an infectious disease. The Organ Procurement Organization is responsible for obtaining medical and social evaluation of each potential deceased donor to reduce the risk of transmitting any donor disease. In the case of a deceased donor, the medical, social, and behavioral history is obtained from the donor's family and friends. The transplant center is responsible for obtaining medical and social evaluation of each potential living donor to reduce the risk of transmitting any donor disease. It is important to note, however, that although donors are screened for infections and other diseases, screening has its limitations. There is no comprehensive way to screen deceased and living donors for all transmissible diseases. Malignancies, cancer, and diseases may be identified and transmitted after transplant. Fortunately, these are very rare due to our screening processes. The transplant surgeon reviews the condition of the donor organ before extending the offer to you. You will be informed if there are any unusual characteristics of the donor. You have the right to refuse kidney transplant at any time without penalty. In certain instances, the transplant team may accept a kidney from a donor who has a history of hepatitis B, hepatitis C. We would consider such kidneys for patients who have been diagnosed with hepatitis B or hepatitis C or have demonstrated protective antibodies. Again, prior to transplant, the team will discuss any risk factors of this donor and the kidney. You will always have the opportunity to decline an organ. During the transplant surgery, you will be put under general anesthesia, which means you will be given medications to put you to sleep, block pain, and paralyze parts of your body. You will also be placed on a machine to help you breathe. The anesthesiologist will meet with you prior to your surgery and review your medical records to determine the need for any additional workup to determine if there are risks from anesthesia. The anesthesia will talk to you more in detail about risks of anesthesia. As in this document, the transplant surgeon will make an incision in your lower abdomen and place your new kidney in the pelvis area, near your hip bone, near your bladder. The artery of the donor kidney will be sewn to the artery that goes down to your leg. The vein of the donor kidney will be sewn to the vein that goes down to your leg. And then the donor ureter gets sewn into your bladder. A drain will be placed into your body to allow fluid to be removed and to help you heal. This drain is removed in a few days. A Foley catheter, which is a thin tube that drains urine from your bladder, will be inserted during surgery and will remain for days to weeks, depending on the condition of your bladder. Under most circumstances, your own kidneys are not removed. You will be in the operating room for approximately 4 hours. After surgery, you will be taken to the intensive care unit where you will be monitored closely. The nurses will be monitoring your vital signs, your lab tests, and your urine output. You will be up and out of bed the next day in order to minimize post-operative complications such as pneumonia, deep vein clots, and pressure sores. Once your medical condition has stabilized, you will be transferred to our transplant unit. Your length of stay in the hospital will depend on the rate of your recovery. You will remain in the hospital as long as your hospitals feel hospitalization is necessary. Any post-operative complications may delay your discharge from the hospital. Most patients stay in the hospital approximately 5 to 7 days. Before you leave the hospital, a nurse will review your post-transplant medications and instructions. You must have a family member or a support person present for your teaching so that they can assist you at home. After you leave the hospital, you will still be recovering. During this recovery period, the transplant team will follow your progress closely. You will need to be monitored frequently, and you must make yourself available for examinations, blood tests, and procedures to see how well your kidney transplant is working. Blood tests may be as frequent as every day to every other day. As you recover and your kidney function stabilizes, your visits will decrease accordingly. Kidney ultrasounds or biopsies may be done to diagnose possible complications, including rejection. We have an office in Orange on the St. Joseph Hospital campus and an office in Los Angeles to better serve you. The transplant team will see you regularly for 1 year post-transplant to address transplant-related issues. Every effort is made to transition your routine medical non-transplant care to your primary care physician as soon as possible. After a year, and if everything is going well with your new transplant, you will be followed primarily by your nephrologist and your primary care doctors. We will continue to schedule you for yearly clinic visits because data on your kidney function and how you are doing is required by UNOS. If you develop a complication or if there is a concern related to your kidney transplant, we will see you more often. Now let's talk about some medical and surgical risks and complications. Without the use of powerful anti-rejection medications, your body will try to destroy the new kidney soon after the transplant. This process is called rejection, and it is a constant worry after transplant. Your immune system protects you from viruses, bacteria, cancer cells, and organ transplants. Powerful medications are used to prevent and treat rejection. These must be taken for the life of the kidney. They are very toxic and have many side effects, and they must be taken correctly. Too much medication develops serious side effects. Not enough medication or skipping doses can lead to rejection of the transplant and transplant failure. Non-compliance is the leading cause of transplant failure. There are many reasons for noncompliance, and we investigate these reasons in the pre-transplant evaluation. The proper use of immunosuppressive medication is essential for a successful transplant, and they do have side effects. Immunosuppressive medications can worsen heart disease, make your blood pressure difficult to manage, promote the development of diabetes, or make existing diabetes more difficult to manage. They can cause life-threatening infections and make you susceptible to certain kinds of cancer. Even with immunosuppressive medications, rejection of the transplant can take place. There is an increased risk of certain kinds of cancer, mostly skin cancer and post-transplant lymphoproliferative disease or lymphoma. Since we closely monitor you after transplant, most complications are manageable. In some cases, aggressive treatment for rejection or infection may be needed. Dialysis may be required until the kidney begins to function. The stress of transplant and the side effects of the medications can cause emotional and coping problems. A successful transplant can dramatically improve your quality of life and give you more energy. However, you may experience a change in emotions that range from sadness and depression to euphoria. It will be important to discuss these changes with your transplant team if they occur. Our social worker is available to talk to you and assist with any referrals. If necessary, a psychiatric consult will be provided and medication prescribed during this stressful time. There are risks of all surgeries, especially surgeries conducted under general anesthesia. You must be aware of the potential risks and complications of surgery that can result in serious injury and even death. Bleeding during or after the surgery may require transfusions or blood products. There are other risks associated with kidney transplants, and these may include urine leak, fluid collection around the new kidney, rupture of the kidney, blood clot formation, blood clots in the new kidney, wound separation and infection, femoral nerve damage, that's the large nerve supplying the leg on the side of the kidney transplant. Burns can be caused by the use of electrical equipment during surgery, and permanent scarring at the site of the abdominal incision. In some cases, complications are serious enough to require another surgery to correct the problem. In extreme cases, the kidney may need to be removed if the problem is not corrected. Most complications, however, are minor and get better on their own. Other medical complications include delayed graft function, meaning that the kidney is not functioning at its full capacity, acute or chronic rejection, post-transplant kidney biopsy bleeding and infection, recurrence of the original kidney disease, pressure sores on the skin, infection from bacteria, virus, or fungus, heart attack, heart arrhythmia, stroke, or even death. For women of childbearing age, return of kidney function after transplant can mean return of normal menstrual cycle and the possibility of pregnancy. Pregnancy should not be attempted for at least 1 year after transplant. One of the anti-rejection medicines, Cellcept, must be tapered off prior to attempting pregnancy because Cellcept can cause severe birth defects. To have a safe and successful pregnancy and delivery, you will need to have stable kidney function, normal blood pressure, no protein in your urine, and the immunosuppressive medications must be at their lowest possible dose. You may choose not to have a transplant. Your nephrologist will discuss other treatment options for your kidney disease with you. It's important to remember that if you have your transplant at a facility that is not a Medicare-approved facility for transplant, for example, having a kidney transplant in another country, your ability to have your anti-rejection medicines paid for under Medicare Part B will be affected. You will have out-of-pocket expenses to pay for your medication if assistance cannot be arranged. You will be given a copy of St. Joseph Hospital Patient Bill of Rights and Responsibility that outlines your rights and responsibilities as a patient. If you have any concerns or complaints, please call the St. Joseph Kidney Transplant Center manager at 714-771-8033. The United Network of Sharing also provides a toll-free patient service line to help transplant candidates, recipients, and family members understand organ allocation practices and transplantation data. You can also call this number to discuss a problem you may be experiencing with your transplant center. The Southern California Renal Disease Incorporated Network 18 also provides assistance and support to chronic renal failure patients and their families. The transplant team at St. Joseph's Hospital is dedicated to improving the quality of life for patients undergoing kidney transplant. We are committed to providing access to transplantation. You must bring a family member to your first meeting with your transplant surgeon. Family involvement is key to your success. You and your family must stay in touch with your transplant coordinator during the evaluation process. The success of the transplant is dependent on your ability to take care of the kidney. Here are some reliable websites that can give you additional information regarding transplant. What happens next? To begin your transplant evaluation, you will have an appointment with the transplant surgeon and the transplant nurse coordinator. At one of these visits, you will be asked to sign that you have received and understand the information presented in these slides. You will be able to ask questions. We look forward to meeting with you and your family and walking on this journey with you.